Your body gives you early warnings long before aging becomes visible. Most men over 40 miss them, not because they're subtle, but because they feel normal. A little stiffness, a slower start to the day, lower energy. Small changes that quietly reveal how fast your body is actually aging. The truth is simple. Aging accelerates first in your joints, hormones, metabolism, and sleep patterns. And the earliest signs show up years before blood tests or checkups detect anything. So let's start with the most common early signal, the one you notice every single morning, but probably never questioned. Waking up a little stiff is normal. After hours of not moving, fluid in your joints settles and tissues cool down. In healthy joints or mild osteoarthritis, that stiffness usually fades within about 5 to 10 minutes of walking around. If you regularly need 15 to 30 minutes or more before your back, knees, hips, or hands feel usable, that can signal low-grade inflammation in the joint lining, not just getting older. Prolonged morning stiffness is a classic feature of inflammatory arthritis, and many guidelines use stiffness lasting over 30 minutes as a red flag. It doesn't mean you automatically have rheumatoid arthritis, but it does mean your joints are under more inflammatory stress than they should be for your age. If this stiffness is daily, getting worse, or combined with visible joint swelling, that is a strong reason to talk to a doctor or rheumatologist. If you suddenly want sweets or refined carbs more than you used to, that is not just liking dessert. It is often an early sign that your body is struggling to keep blood sugar stable. When cells become less responsive to insulin, glucose stays higher in the blood, then drops faster, and the brain pushes you to reach for quick sugar to correct it. This pattern is a hallmark of developing insulin resistance. Insulin resistance is strongly linked to increased abdominal fat, higher risk of type 2 diabetes, fatty liver, and cardiovascular disease. And it often begins years before fasting glucose or HbA1c cross the abnormal line on lab tests. New cravings that cluster after meals, late at night, or when you try to diet aggressively are especially important to notice. Combined with belly fat, low energy, or family history of diabetes, this is a warning sign worth acting on and discussing with your doctor. If you notice you are more irritable, impatient, or easily annoyed than a few years ago, that can be a biological warning sign, not just a personality change. In men over 40, chronic stress, poor sleep, and hormonal changes can all affect brain chemistry. Sleep restriction alone has been shown to increase negative mood, tension, and anger, even in healthy adults. Low testosterone is also linked with low mood, irritability, and reduced sense of well-being in men, especially when combined with high stress or weight gain. At the same time, chronic, low-grade inflammation and insulin resistance are associated with a higher risk of depression and anxiety symptoms. None of this means every bad day is a disease, but if irritability is frequent, affects relationships, and comes with poor sleep, low energy, or low libido, it is a meaningful sign that your stress, hormones, and metabolic health need attention, and possibly medical evaluation. If you are lifting less than you could a few years ago, struggling with everyday tasks like carrying groceries, or finding it harder to get up from the floor or a low chair, that is not just normal aging. It can be an early sign of sarcopenia, age-related loss of muscle mass and strength. Research shows that after about age 40, adults can lose around 1% of muscle mass per year, and muscle strength can decline even faster if you are inactive, sleep poorly, or eat too little protein. Lower muscle strength is strongly linked with higher risk of disability, falls, hospitalization, and earlier mortality in middle-aged and older adults. If you are consistently weaker despite similar effort, especially combined with weight gain around the waist or slower recovery, treat it as a health signal. Resistance training, adequate protein, good sleep, and medical evaluation when needed can slow or even partially reverse this decline. Occasional night waking is normal, but if you regularly snap awake around 2 to 3 a.m. and struggle to fall back asleep, It can be a sign your stress and metabolic systems are under strain, not just a bad habit. This time window often coincides with the low point of your nightly blood sugar and natural changes in cortisol. When blood sugar dips too far, or when cortisol is elevated from chronic stress, your brain gets a wake-up signal instead of staying in deep, restorative sleep. Fragmented sleep like this is linked with higher cardiovascular risk, weight gain, insulin resistance, and mood problems in middle-aged adults. If this happens most nights, especially with daytime fatigue, irritability, or increased belly fat, treat it as a meaningful warning sign. Improving sleep hygiene, reducing late-night alcohol and heavy meals, managing stress, and discussing it with a healthcare professional are all appropriate next steps. If your face and arms get thinner, but your waist barely changes, that is not just stubborn fat. Central or visceral fat, the deep fat around your organs, is metabolically different from the fat under your skin. It is strongly linked with insulin resistance, high blood pressure, abnormal cholesterol, and higher risk of heart disease and type 2 diabetes in men. After 40, hormonal shifts, lower muscle mass, poor sleep, and high stress all push more fat toward the abdomen. Dieting too hard or too often can make this worse by lowering muscle mass and slowing metabolic rate, while the visceral fat remains relatively active. If your belt size is stuck or increasing despite eating less, especially if you also have sugar cravings, low energy, or snoring and poor sleep, treat it as a serious health signal, not a cosmetic issue. Strength training, higher protein intake, better sleep, daily movement, and medical checks are all warranted. If you feel mentally flat most days, with low drive to train, work, or start tasks you used to handle easily, that can be a biological warning sign, not just midlife stress. Chronic fatigue and reduced motivation are common in men with sleep problems, depression, low testosterone, obesity, and metabolic syndrome. Large studies link persistent fatigue and low vitality with higher risks of cardiovascular disease and earlier mortality. Mitochondrial efficiency also declines with age, especially with inactivity, poor diet, and chronic inflammation. That means your cells literally produce less usable energy from the same food. Combined with short sleep, high stress, and little movement, you get the classic pattern. You're not completely exhausted, just never truly energized. If this flat, unmotivated state lasts for weeks or months, especially with weight gain, low libido, or poor sleep, it deserves attention. Lifestyle changes help, but proper medical evaluation is important to rule out anemia, thyroid issues, low testosterone, sleep apnea, or depression. If even one of these warning signs sounded familiar, take it seriously. Your body doesn't decline overnight. It sends signals first. When you catch those signals early, you can slow down aging, restore strength, improve sleep, and regain the energy that makes life feel sharp and purposeful again. Small daily changes compound fast, especially for men over 40. If you want support on that path, we've linked the exact supplements we personally use in the pinned comment below. They're high quality, vetted, and they help support the channel at no extra cost to you. This is your second prime, and it can be stronger than your first if you take control now. Each week, we break down science-backed strategies designed specifically for men over 40 to stay healthy, strong, and mentally clear for decades. Make sure to subscribe for new videos every week. And remember, taking action today is the fastest way to slow down tomorrow's aging. If this video helped you in any way, even one small change you'll try tonight, leave a like. It tells the algorithm to show it to someone else who might need it. And if you want more clear, science-backed ways to protect your body and sharpen your mind after 40, stick around for more. Your second prime isn't about going back. It's about staying sharp, steady, and strong.